Today, we are going on an epic journey through human history to tell the story of nursing. It's a profession that started with a basic human instinct to care for one another and evolved into this incredibly complex global science. It's really a story of art versus science, compassion versus data, and it's a journey that has absolutely shaped the world we all live in.
So right at the very heart of nursing, you'll find this powerful duality. It is both an art and a science. And believe me, understanding this tension, this constant dance between these two big ideas, is the key to unlocking its entire history.
So on one side you have the art. This is the compassion, the hands-on skill, that pure human connection. And on the other, you have the science, the research, the data, the evidence-based practices that, literally save lives. We're going to see how these two forces have sometimes clashed and other times worked in perfect harmony to shape what nursing has become.
All right, so let's rewind all the way back to the very beginning, to the ancient world, where the very first blueprints for what we'd call organized healthcare were being drawn up.
All across the globe, you see, early civilizations were developing some pretty sophisticated systems of care. Now, their science was often tangled up with things like magic and religion, but the art, that fundamental human act of caring for the sick and the injured, well, that was everywhere. It was a universal constant.
Our first stop is ancient Egypt, a civilization of just incredible innovators. I mean, think about this. As far back as 3000 BC, they were the first people to actually keep medical records. They weren't just treating symptoms, they were recording outcomes, learning from the past, and even specializing in certain diseases. This is it. This is the first faint pulse of the science of healthcare we see taking root. Now, over in ancient Greece, things get really interesting. The legendary physician Hippocrates, he makes his revolutionary shift. He argues that diseases have natural causes, not supernatural ones. This was a massive leap from medical science, bringing in concepts like diagnosis and prognosis. But, and this is a big but, look at that last point. The actual art of nursing, the hands-on care, was often seen as unimportant, left to untrained slaves. This created a huge gap between scientific theory and practical care pretty early on. Our tour of the ancient world wraps up in India, which had its own amazing system. You have the Ayurveda tradition, which focused on hygiene and prevention, while surgeons like Sushruta were performing really complex operations. But what's really crucial here is that King Ashoka established public hospitals and staffed them with dedicated male nurses and older women. That's a clear sign of formal, organized care where the art was actually given structure and importance.
For centuries, caregiving was still pretty informal. But two powerful forces, organized religion and the brutal reality of war, were about to become catalysts. They would start to forge nursing into a real profession, with formal training and its own unique identity.
But here's the thing, progress wasn't a straight line. During the Renaissance and Reformation, while art and science were booming everywhere else, hospital care just plummeted. They became so unsanitary, so dangerous, that this period is often called the Dark Ages of nursing. A new kind of caregiver, one with real structure and standards, was desperately needed.
And that need began to be met by incredible figures emerging from faith traditions. In early Christianity, you had deaconesses like Phoebe, who were handpicked by the church to provide expert home care. In the history of Islam, you have Rufaidah al-Aslamiyah, trained by her own physician father, who's recognized as the first professional nurse. She even led medical teams right onto the battlefield. This is a huge step toward making nursing a distinct profession. And then came a revolution, and that revolution had a name, Florence Nightingale. When she showed up in the Crimean War, she didn't just bring compassion, she brought a clipboard. She used data and statistics to prove that sanitation was the key to survival, a totally radical idea at the time. She then took that scientific proof and created a blueprint for modern nursing education, a model that just spread like wildfire across the globe. I mean, the scale of the challenge she faced is just staggering, a 40% death rate. Her success in cutting that number down so drastically, not with some miracle drug, but with simple hygiene and organized care, proved once and for all the power of evidence-based nursing. This was it, the perfect fusion of the art of caring and the science of data. Nightingale's work really lit a fire. The late 19th and 20th century saw this explosion in formal training, transforming nursing from a calling, a vocation, into a rigorous, respected profession.
So, how did this whole transformation happen? Well, it started with pioneering schools like the one in Germany where Nightingale herself actually studied. Her model, which insisted on combining classroom theory with hands-on clinical practice, became the gold standard. And soon enough, hospitals all over the world were opening their own schools, creating a steady pipeline of professional nurses and really cementing nursing status.
Now, this historical evolution isn't just something stuck in a textbook. It's a story that is still playing out today. And to see how, let's look at a really modern case study: the development of the nursing profession in Pakistan, a nation that's faced many of the same challenges as the early pioneers of nursing.
Right after its founding, Pakistan had a major shortage of healthcare workers. But just look at this chart. The country made incredible progress. Between 1960 and 1997, the nurse-to-population ratio improved dramatically. That leap from one nurse for every 32,000 people down to one for every 5,000, that shows a nation making a serious strategic effort to invest in its healthcare workforce.
But, and this is really important, that historical progress doesn't mean the work is over. Not by a long shot. Today, the nurse-to-patient ratio is about 1 to 50. That's a huge challenge when the recommended standard is closer to 1 to 10. This single number really highlights the constant, ongoing need for more qualified nurses to meet the demands of a growing population.
So, to meet this demand, a massive educational infrastructure has been built. This isn't just a list of numbers, it's a snapshot of the solution. You can see hundreds of nursing institutes spread all across the country, from populous regions like Punjab and Sindh to more remote areas. This is the modern version of Nightingale's first school, just scaled up for a nation of over 200 million people.
And behind it all, you have the Pakistan Nursing and Midwifery Council. It was established way back in 1948, and it's the regulatory body that ensures quality and competence. It's the science part of the modern equation. It sets the curriculum, issues the licenses, and holds the entire profession to a high standard. It's the engine that powers the whole professionalization we've been tracing.
So, after this journey through thousands of years of history, we come back to our central theme. We've seen nursing evolve from a basic instinct to a vocation to a highly skilled global profession. So what comes next? We end where we began, with that core duality. As the science of medicine becomes ever more complex with AI, with genomics, with robotics, the great challenge is going to be preserving the irreplaceable art of nursing, the human touch, the compassion, that fundamental skill of simply caring. That is the question that will define the next chapter in this incredible story.